All right, we're going to go ahead and get started. So I want to tell you all, thank you so much for being here. Welcome to the COVID-19 Solution Ideation Workshop. And we're really looking forward to creating ideas here together. And here we go. So the organizers of this event are IMAGINEi5. I'm just going to go ahead and introduce myself and my co-organizers. So my name is Sarah Kalick, co-founder of IMAGINEi5. I'm also an engineer in the medtech space, and I'm also a consultant in that space. I'm currently pursuing my MBA at UC Berkeley. So Adriana, go ahead.
Awesome. Yes, I'm Adriana Peñuela, and I'm one of the co-founders of IMAGINEi5 as well. So I'm an engineer by background, chemical engineer. I do a lot of work in the Engineers Without Borders space. One of my passions is to help out socially around the world and connecting that culture together. And yeah, also a candidate from UC Berkeley MBA. Go ahead, Clarice.
Hi everyone, I'm Clarice. I'm also co-founder of IMAGINEi5. I'm currently pursuing my MBA degree with UC Berkeley. I have another master degree in construction and specialize in contractor and project management. It's really nice to meet you.
We're so glad to have you guys here with us. So I want to bring up our partners and our sponsors. So COVID Accelerator is one of our partners. Tito and Ari are online here. We're going to definitely introduce you guys during this talk. So what the COVID Accelerator is, it's a community that provides resources to help teams move forward and bring projects to reality. So many of you are either in the accelerator right now or are looking to continue your ideas after this event. So we really want to encourage you to move forward in this community. So Miro, this is Miro logo. Miro is a design tool which we'll be using here today during the workshop. They actually sponsored us by giving us all these boards for free. So big thanks to Miro. Other partners and sponsors for this event are the Determinant. They're a creative studio and design community. They're going to lead us through a warm-up today before you get started. Las Doctoras Recomiendan, I hope I pronounced that accurately, is a pediatric health podcast hosted by Dr. Edith, who'll be speaking here as well. Berkeley Hops. So, hey, you know, all three of us are very well acquainted with Berkeley Hops. Berkeley is a sponsor of our event, and it's a world-renowned MBA program. If you haven't had a chance to look up Berkeley, please check out their website. They're a great university and has sponsored us quite a bit for this, for all the workshops that we've done. And then finally, the Play Project is an organization that works on projects that inspire symbiotic individual and community development. And that's one of the projects that I run. So we're gonna go ahead and get started. So as we all know, in just a few short months, the coronavirus has affected our lives and our communities. It has put healthcare, essential service workers, and elderly at risk, and brought our jobs and education online, and required us to shelter in place. However, out of all of this, we have also seen a lot of support and care come out from all of you today and from others to build up our communities. Just a few examples are 3D printing hobbyists making masks, organizations like Zoom giving remote connection to schools for free, and you know, everybody coming together to build up their community. So we're here today to support and care for our communities too, and that's the intention of this event. The main question that we're looking to answer is how might we rapidly empower and support our communities to stay healthy and safe during the COVID-19 pandemic and into the future. So this is the primary question that we're going to be focusing on. And in order to address that question, our workshop aims to inform you about COVID-19 and the communities most impacted. We want to ideate together in the workshop to create solutions. And finally, we want to help you act after the workshop. We give you all these details, so if you want to go onto our website at IMAGINEi5.com, there's a tab under COVID-19 workshop. There you'll have all the links and references that you'll need during this event and then afterwards. So from there, I want to really introduce you to Dr. Edith Bracho-Sanchez. She's an assistant professor and director of pediatric telemedicine at Columbia University Irving Medical Center. She also acts as a health journalist who has spoken on multiple media outlets. So we're really, really excited to have her here today. She's going to inform us about communities that are impacted and tell us a little bit about her day-to-day work that she's seen due to COVID-19. So if you don't mind, Dr. Edith, I'm going to stop sharing here and give it over to you.
Sounds good. Thank you so much. I'm so excited to be with you guys today and just sort of share a little bit of what I have been seeing. And let me start sharing my screen for a second, and then you guys tell me if this is working. Working? Yes? Thumbs up? Love it. Okay. So I am, as you guys mentioned, a pediatrician. But as a pediatrician, you know, people always think, oh, you care for children, you care for small children. And what I really like to sort of start with is that I care for families. This is really not just children, although I love children and very much care for them. I view my role in my profession and my daily work and very much in this pandemic as caring for families. I joined Columbia University a year ago, and at that point they brought me in sort of to build the telemedicine program with the thinking that I was a communicator and someone who could sort of play well with different people and try to build a program from scratch. At that point, not really realizing that telemedicine was going to explode and play such a big role in this pandemic. But what I want to tell you about today is more about our families and our communities and how they're living the things that are going on. So at this point, I think it's no secret. I think most of you have seen these headlines. And truly our Black and Latino communities have been disproportionately impacted by COVID-19. And that's been for a number of reasons. And perhaps before I move to the next slide, I'll just share a story. I very much, as you guys heard, I work for the media, and I think stories sort of illustrate things better sometimes than any sort of statistic or number could, although it's nice to have statistics and numbers to go with your stories. But I, as a pediatrician, work for, as I mentioned, Columbia, and it's a primarily Medicaid community. I only see families who are insured by Medicaid, but sometimes on weekends, I also moonlight for an Upper East Side practice. For you guys who are familiar with New York City, Upper East Side is a very wealthy and professional, up-and-coming neighborhood. And you know, the difference when I am on call for one practice versus another practice is what I want to talk to you guys about. This past week, I was on call for the Upper East Side practice. I did not get a single phone call from a parent. This weekend, however, I am on call for the Washington Heights, the Inwood community of New York City, and my phone has been blowing up. And that is because families in the Washington Heights and the Inwood community who are insured by Medicaid, low-income families, are definitely seeing the effects, right? So the children are okay in the sense that the illnesses have been minor. But when I speak to these families and when I answer the phone calls, it's the fear. It's sort of like, you know, I just want to make sure. I want to make sure that everything's okay. I want to make sure that this isn't anything more serious. And when you start to ask a little bit, why are you so scared? We know that children are doing okay. These families then tell you, well, grandma was in the hospital, grandma just passed away, grandpa just passed away from coronavirus. And when you start asking, well, did you guys shelter in place? They said, you know, as best we could, but you know, dad works for Uber, or dad works for a food delivery service, or you know, we had to take the subway, we had no choice. So it's sort of like very, very different. The Upper East Side community, when I take call, they're very much sheltering in place and everyone's sort of staying home, whereas when I work for the Washington Heights Inwood Medicaid community, the fear and the impact are undeniable. In addition to what you guys have seen on the headlines, and what you guys have heard about stories of how tragic this has been. So to sort of, with that story and take it to the next step, I just I want to sort of outline some of the direct impacts that this pandemic has had on some of these communities. So as I mentioned, people in these communities are essential workers. They're part of the gig economy, right? You guys are familiar with the gig economy. I don't need to tell you, you guys are all business students. And then they really truly have not had the privilege of staying home. And in addition to that, another layer that I think people have not talked about enough is that information that has come, especially to Latino and immigrant communities, has been minimal, has been confusing, and when it's come too late at times. So not only is there, all of this fear and confusion, and they're still having to go out because, again, they're essential workers, they're part of the gig economy. On top of that, the information that they are receiving in order to make, that should be able to help them make choices and sort of continue to do their essential jobs in the world and minimize some of that risk, has not really been timely or accurate. And the results of this have been devastating. So these communities have had higher rates of COVID-19 diagnosis. They've also had higher rates of deaths. There's also been, those are, I guess, like the obvious, right, impacted by COVID. But I think we cannot underestimate what the loss of work is doing for this community when it comes to food insecurity, housing insecurity, and worsening health. And when you guys think about, I guess when I say food insecurity and housing insecurity and sort of this economic, financial instability, this is really, it's not a temporary, like, let's get families through, this just happened because of this pandemic. No, like, these were families that were already struggling to make ends meet. And when we think about food insecurity and financial instability, I always like to remind people that this is what is called a social determinant of health, right? Like, this is something, a condition in which people are living and going about their daily lives that impacts their health. And ultimately, there's absolutely no question, the literature is clear, that when families experience food insecurity, housing insecurity, neighborhood violence, there's a number of social determinants of health, the ultimate result is worse health outcomes. Which is the unfortunate part of this. And then, in addition to those direct, and again, this is a full disclosure, very arbitrary breakdown on my part of direct and indirect effects. But I think when we talk about some of the additional effects of the COVID-19 pandemic, we can't underestimate the effects that trauma and fear is having on some of these communities. So there's individual grief. I think many of these communities and many of these families have been touched directly by COVID. They've had family members, as I mentioned earlier, that have passed away, family members that have gone to the hospital. And then in the community, right? Like, even if it's not someone directly in your family, someone who had to be taken to the hospital, someone in your neighborhood, someone in your building, someone you work with. So there's also this component of mass grief. And then there's also a component of fear, right? Like, when we think about the environment onto which the COVID-19 pandemic landed, and when we think about some of these communities, there was already, unfortunately, existing government and institutional mistrust, and this is something that was done somewhat deliberately and has been happening, right? Like, when you guys think about what's happened when it comes to immigration law and the rapid changes that we've seen in the past couple of years, there's been sort of a crackdown and sort of a, the government is out to get us sort of feeling in these communities, and rightfully so, and some level of mistrust, right? And so now you add COVID-19, and now you're saying to these communities, the same institution that has been cracking down on you, that has been trying to sort of get less people that look like you to come into this country and make it really difficult for people who look like you to live and thrive in this country. Now it is that same institution who you have to trust with your medical care, with your life, really, the decisions that you're making. And so it's sort of no wonder that there is mistrust, and that this has unfortunately resulted in delays in seeking medical care, delays in vaccinating babies. And you know, it really, I can't emphasize that enough. It's not surprising to me. It's sort of a no-brainer that this additional level of fear now of a virus on top of everything that had already been making these communities fearful has resulted in so many delays and so much hesitation in coming to see us. And then the other sort of indirect effect of this pandemic that I think we have not started truthfully yet to talk about, but I think is definitely important that we start to think about as we move into the next phase, is the loss of school and the consequences that it's having. So for many kids, loss of school, of course, has resulted in a loss of routines, a loss of education itself. But I also like to remind you guys that in many inner city communities, schools actually provide health services, for example. So I had a patient this past week who had been coughing just horribly for the past 2 weeks. And of course, mom is a healthcare worker and had COVID, so had grandma, and this child had been coughing for 2 weeks. No fever, nothing else, just a horrendous cough. And when I look in her history, she's an asthmatic, right? And so when I look a little more, she's supposed to be on a medication every morning to sort of damp down her inflammation that she has in her lungs. And when I ask what happened, why haven't you been taking this medication? The mom says to me, well, you know, she used to get this medication at school every morning. So truthfully, we don't even have this medication at home. And so you sort of start to wonder, okay, what are sort of the downstream consequences of no school and sort of some of these services that schools provide? And then the other thing that I just like to throw out there and share with you guys is that schools file approximately 20% of all of the reports for child abuse and neglect in this country, of which there is close to 3 million a year, not all of which are substantiated, thank goodness, but there is a large amount of reports for abuse and neglect that are filed by schools. And we as pediatricians are very, very worried, because when you look at the numbers, they're currently down. But when you look, for example, at phone calls to domestic violence hotlines, those numbers are up. And by every measure that we have, anytime domestic violence goes up, so does child abuse and neglect. So we don't believe that this is truly down. We actually believe that it is not being spotted, it is not being reported, because nobody else is checking on kids. And parents are extremely stressed in this communities. Again, by every measure that we have, phone calls, for example, to the suicide hotline are up. And so there's no question that parents are stressed. There's no question that domestic violence is up. And those are two surrogate measures, what we call surrogate measures for child abuse and neglect. So again, we're super worried. And then I guess just to stress it a little bit more, I think we are, in the past week or two, I think you're seeing more pediatricians, myself included, sort of trying to be vocal about this, trying to talk about some of the delays in vaccination, some of the delays in care that this fear is causing in our communities. And this is not just in this country, this is also happening around the world. This statement that I have down here, more than 117 million children at risk of missing measles vaccines, was put out by UNICEF, because they have had to delay and postpone their own vaccination campaigns around the world because of COVID, right? And I guess before I move on, I just, and I talked about this story in this article that I just published for CNN yesterday. When I say delays in care, this is what that means. So not this week, the week before, I saw a child who accidentally spilled soup, very, very hot soup, onto her leg. And the mom was terrified to bring her into an emergency room or bring her into clinic because of COVID, right? So the mom waited 5 days for this burn to get better, and she tried to treat it with home remedies and some ointments and things. And by the time I saw her through telemedicine, it was so bad. I mean, necrotic tissue, just really, really terrible looking burn. I had to send her to a burn unit immediately. So when I say delays in care, that is what I mean. And when I say delays in vaccination, what I mean is I'm calling families and I'm saying, listen, we've taken all kinds of precautions to keep the clinic clean, like sick kids are not coming in. Immediately as you come in, you'll be given a mask, like every family's being given a mask. And no matter what I say to families, they just say, I hear you, but I'm not leaving my home to vaccinate my child. So then knowing all of this, and hopefully I've painted a picture of some of the challenges that we're experiencing, we have to start thinking about the way forward, because yes, COVID is with us for a while, but it's not with us forever, and we need to start preparing for the future. So there's going to be a new normal before there is a really normal before. And so some of the questions that we are asking ourselves is, how do we help families cope with grief? How do we help children cope with grief, right? They've been sheltering in place against, or I guess protecting themselves from a common enemy, sort of a virus out there that to them is very real, right? Like if your grandmother passed away from a virus and you are sheltered in place because of that same virus, that threat to you as a child in an immigrant community is very real. So how do we start to sort of slowly help children come out of the shelter in place, and how do we encourage them to take risks, and what kind of resources will our families need, and how do we foster community and play to the strengths of every community so that we can transition out of this situation. And with that, I am done. I'm of course happy to take questions. I don't know if you guys have time for questions, but if you don't, you can always email me. This is my email, and you can also find me on Twitter.
Oh my gosh, thank you so much, Dr. Edith. You have done an amazing job presenting a picture for us in terms of what's going on out there, what are we seeing, and well, it gave me a chills at some point to hear so much information about our communities around the world, and yeah, it made me tear a little bit. So really, thank you very much. So now we're gonna go and take a couple of questions from you guys. There is a button, so if you go into your participants view in the bottom of your screen, you can click on the participants and raise your hand. So let me know if there is anyone have any questions at this point. We're gonna entertain a couple of questions. Well, maybe I have a question for you. So what we say for all these ideators in order to like come up with the best idea, what is the most pressing need that you have like to solve right now?
I think right now there is hunger and there's housing instability. These families, which I didn't mention, but these families are scared, obviously, and even community organizations that are coming to deliver food to some of these families, they're too scared to open the door. These are families that are also, have been communities that have been raided by ICE. ICE has not stopped raiding communities. I don't know if you guys knew that in the middle of this pandemic. So there's hunger, there's housing instability, and we need to be really creative about how we solve it, because these are really sensitive communities that don't allow, just a random stranger to come knock on the door and give them food. And so I think that's the most pressing. And I think the next level after that would be the trauma and the grief that I talked about.
Nice. Well, thank you. So I have a question from Leslie. Do you have any ideas on how tech can help kids at this time?
Yeah, so that's such an interesting, I'm always asking myself that question. So for one, I have, started this telemedicine program that has scaled so quickly to be able to, provide care to families who are scared and in their homes. So that's one way to sort of be able to give care and give access when families are sheltering. And when it comes to kids themselves, I'm trying to figure that out myself. Because I'm partnered actually with Sesame Street, and they're creating a number of materials for children. And they have, they're the pros when it comes to sort of addressing trauma in a way that's sensitive for kids. But I think it's sort of this balance of, you want to be supportive, you want to provide content that is relevant, that is helpful, that is engaging, but at the same time, you don't want kids spending too long in front of screens, right? I'm also part of all these kinds of committees, the American Academy of Pediatrics, and we limit the amount of hours that kids are supposed to be in front of screens. So it's sort of like this balance of how do you create things that are helpful, but also don't spend too long in front of screens.
Thank you. Okay. So Malika posted a question. Can you talk about the relationship between fear and telemedicine, and how is talking to a stranger from an institution on a screen about your body perceived right now?
Yeah, so that's an interesting question. So for the majority of families, when we offer telemedicine, we say, right now, we're trying to keep as many families as we can at home. We have this option where you can have a video visit with your provider. It's kind of like FaceTime, but you have to download a different app. And so we say that to them. And we also say, but if you need to be seen in person by a doctor, we will refer you after that. So we don't sort of make it like you will only be seen by video and you cannot be seen in person. And for the vast majority of our families, they've been very receptive. And what's helped in our case, which is not the same benefit that, for example, Teladoc, which is a private company, direct-to-consumer private company has. They truly have random pediatricians, or not even pediatricians sometimes, random, which is another problem that I have. But anyway, so they have random people sort of talking to these families. In our case, it's been the same pediatricians that you're used to seeing in the office, that they just come on screen, right? Like I'm seeing some of my own family. So in that regard, it's helped. But I think it's a good question, because some families have been really hesitant. I had a mom, and again, it's that fear and that anxiety, right? I had a mom who I saw through video visit once, and she called me 3 times in the night. She called me at 11, she called me at 2 a.m., she called me at 4 a.m. And it was just finally I had to say to her, I think you have to go to the emergency room, not because I'm really that worried about your baby, but because you're really worried, and you and I both need to listen to your mom intuition, right? If something's telling you that something's not right with your baby, and clearly what I'm providing as reassurance is not reassuring you, then you and I both have to be humble enough to listen to your mom intuition, and you need to go to the emergency room. And so she went. So that's sort of that.
Great. Okay. So we're gonna wrap up the questions, but we're gonna take all of your questions, or your amazing questions from the chat. I see a lot of questions coming up, and I'll pass them along to Dr. Edith. And if you have some time for us,
Yeah,
we can maybe get your answers sent out and posted in our website.
great. That sounds great.
Thank you.
Thank you guys for having me.
Take care. So nice to see you. Okay, so now we're getting ready to ramp up our brains and start the ideation process. So to kickstart us off in this journey, I'm gonna pass the ball along to Mark and Sarah. So they are the founders of the Determinant, and who are a creative studio for a climate resilient world. And they use innovative design strategies to amplify climate projects to create sustained impact. So Mark and Sarah, you can share your screen and the floor is yours.
Awesome. Thank you. Just get my keynote together. Awesome. Yeah, well, thanks for all that information, Doctor. Appreciate it. And thanks for another invite from the team here. We did a jam session a few weeks ago and came up with some really awesome ideas. So I'm looking forward to seeing all the ideas generated by the groups today. So I'm going to kick off the idea generation part of the workshop with a little bit of background. Get ready. Okay. So we always like to ask this question: who says brainstorming has to be so serious? As Adriana mentioned, I'm one of the co-founders of the Determined. We are a creative studio for a climate resilient world. We work with organizations tackling climate change. we do everything from branding to messaging to marketing, a lot of innovation strategy work. And so with this pandemic happening, we are also using our services to help organizations and communities like you all come up with really unique, innovative ideas to flatten the curve. I'm sure some of you have heard of the design thinking process. We feel like we've kind of hacked it. We're going to dive into the think wrong stuff today, but thinking wrong is really good for the first phase or the first few phases of the design thinking process. And Sarah, my business partner, she studied under Tom Chi. His whole thing is called prototype thinking, which really puts a lot of emphasis on, you guessed it, prototyping and testing of these ideas. But for the purposes of today, we're going to jump into the thinking wrong. Just a quick side note, a shameless plug. If there are any designers here, we have a project called climatedesigners.org. So if there's any designers on this call today that are interested or that have an interest in tackling our climate crisis, definitely check out climatedesigners.org. It's a hub for designers and creative professionals from all industries committed to using our creative skills for climate action. So shameless plug, thought I wanted to put it in there, but let's get back to the workshop. If there's any questions on that, feel free to put them in the chat. So yeah, what is thinking wrong? So Thinking Wrong was developed by one of my mentors, colleagues, friend, John Bielenberg. That's him standing to the right of me. I've been working with John and other people on this Think Wrong process for over 10 years now. He started to kind of develop this process in the early 2000s, and me and a number of colleagues have kind of produced a number of exercises and processes and methods on the Think Wrong process, and now there's a book on it, so check it out if you want to learn more. So our brains like to be safe. As humans, we don't like to learn new habits, or if we do, it takes a lot of time to develop those habits. We have a lot of existing cognitive biases that are working actually against us. And then as we get older in life, we start to develop these predetermined linear thought pathways. So a question I like to ask in a group of people at the start of a workshop is, raise your hand. I can't see you all now, but raise your hand if this morning when you were putting on your shoes, you actually thought about tying your shoelaces, right? You actually put the mental energy into tying your shoes on your feet. Probably not, right? Because you've been doing it for years, if not decades. You've developed those synaptic connections. You've already created those pathways in your brain to solve that problem. And so this is good because that has helped us kind of evolve as a species. So we need that. But if you think about it in the creative process, it actually can be a hindrance. It can actually backfire. So follow me now. So this is a very detailed illustration of the human brain. You have problem A, solution B. And so again, as we get older in life, we tend to go to our first solution because we feel comfortable. It's fast, it's easy. So for an example, as a designer, I like to use this little example. So I am interacting with a coffee shop owner, and he goes, "Hey, Mark, can you design the branding for my new coffee shop? Menus, logo, website, things like that." And I'm going to go into my mental filing cabinet. I'm going to go and think about all the coffee shops I've been into. And from there, I'm going to probably produce something that looks like every other coffee shop. So maybe a coffee bean logo, maybe a green and brown color palette. It's not very unique, or it doesn't really stand out amongst the competitors. And so that's me going from a problem to solution right off the bat. And so what Thinking Wrong does is that it encourages you to explore new innovative areas so that you can come up with more unique ideas. So it's really great for innovating those ideas and challenging the status quo. It's about breaking the connections that keep change from happening. And you always want to start crazy. You always want to start pie in the sky and then pull something down that you can work off of. You can never really do it the other way around. It's super hard to start with a really, typical, boring, mundane idea and go crazy. It's not impossible, but it just tends to be a lot harder. So I'm going to be asking you all, when you get into your breakout sessions, to push yourselves when it comes to coming up with creative ideas. And then from that little, from those crazy out there ideas, you can pull down a little nugget of something that we can actually build off of. So a few examples I'd like to go over. If any of you remember when Lyft launched, specifically in the Bay Area, maybe beyond other cities, they had their drivers driving around these pink furry mustaches. And that was like a really interesting marketing approach. They didn't spend a whole lot of time and energy on billboards and ads and things like that. They just have their drivers drive around in these pink mustaches, which made, you know, passengers or people walking on the street say, hey, check out that pink mustache. What the hell is that? Someone might respond, oh, I think that's this new car sharing service called Lyft. Another example I like to use is now the defunct airline Virgin America. They have this really fun, entertaining safety video that actually made you want to watch the safety video. How many times do we jump back on our phones or crack open a book on a plane when we get to that part of our plane experience? And it's really interesting too, having all these other airlines after them kind of copy them. Some not so great, but Virgin America was the first to kind of think wrong about the safety video. And then another example I like to use is a company called Liquid Death. They're totally disrupting and I really hate to use that word, but for the lack of a better word, they're totally disrupting the water bottle industry. So this is actually canned water. And there's a whole backstory behind it. Definitely look up liquiddeath.com, but I love their branding. I love their approach. Definitely check out their social media. They're totally like, you know, sideswiping all the other bottled water companies when it comes to branding and messaging. They're attracting a very different audience, big, you know, big burly dudes or people that are a bit more, you know, misfits or rebels. And they're the ones that are buying their stuff. And a lot of their social media marketing campaign is actually crowdsourced. So they actually put the emphasis or the highlight or the spotlight on their followers, which is pretty cool. So highly recommend this company. It's a really fun brand to check out. So these companies use a number of unconventional methods to come up with these ideas, right? Pink mustache, who would have thought that would have worked, right? Or labeling a water company as something that looks like a heavy metal band. And so you got to really think outside of of your typical processes to come up with these ideas. And what thinking wrong does is that if you go and look into that book, for example, you'll uncover a ton of different exercises all throughout the creative process that we've developed over, you know, almost 20 years now. And so one of these exercises that we love is a classic think wrong exercise called hidden talent. So I'm going to kind of get off of the COVID conversation just for a little bit and kind of dive into this think wrong exercise. And then in a few slides from now, I'm going to bring them all back together. So hidden talent, right? So we all have hidden talents. Some people might be able to juggle bowling pins. People might be able to speak different languages, right? Everyone has a hidden talent. My personal hidden talent for myself, I have a really high tolerance for spicy food. Give me all the habaneros, give me all the ghost peppers, I love it. More hidden talents, maybe you can play classical piano, maybe you can say the ABCs backwards. So we all have some sort of hidden talent, right? And so with, actually I'm gonna pause here and in your chat box, just for a few, maybe like a minute, let's go ahead and maybe if someone has a unique hidden talent, go ahead and share that out. Anyone? Writing, awesome. Unicycle. Shopping is a hidden talent. There you go. Tap dance, very cool. Ping pong. You can lick your nose, that always comes in handy. Drumming, bend your thumbs backwards, props to you. Dog whisperer, great. These are awesome. Competitive Pokemon, great. So keep them coming. These are really fun. Singing country and karaoke, thumbs up. Okay, so thanks for that. So keep those in mind. If you haven't thought about one just yet, don't worry, we'll give you time to do that. So hidden talent. So when we ask for people's hidden talent, we then follow up with this question: how can we use a talent unique to us as a starting point to come up with fun, innovative ideas to address a challenge or problem, right? And these can be used as literal, or they can be inspired by, right? So you don't have to insert your singing of karaoke, country karaoke into the challenge, but maybe singing, or maybe just a platform for people to come up and share ideas amongst an audience, for example, right? You can use your hidden talent a bit more abstractly or conceptually, or be very literal about it. So then going back to why we're all here today, we have our how might we statement. This is the statement, or the how might we challenge that we're going to be focusing on today, right? It was addressed in previous slides from your previous speakers. how might we support and encourage our communities to stay safe and healthy during the COVID-19 pandemic and into the future? So that's kind of our guiding light throughout the rest of the day. So with that, how can we combine some of these hidden talents to address this challenge? So I can juggle bowling pins. So how could that be implemented into the challenge, right? So think of it more as like a Mad Lib, and I'll give you a few examples. So someone did mention writing, so you know, you can maybe take this. So how might we use writing to support and encourage our communities to stay safe and healthy during this pandemic? Well, so if we think of a particular audience that are out there that are being affected by COVID-19, right? So here's a possible solution. So the elderly are lonely and isolated from their families out of fear of illness. So perhaps we can create some sort of pen pal network with fellow writers in partnership with local retirement homes. So you see what I did there is I took my hidden talent and used it in a way that was able to address a particular set of audiences while addressing this challenge, this pandemic. Another one, perhaps some of you are really good cooks. So how might we use amazing cooking skills to support and encourage our communities? So another possible idea could be, you know, applying that to families with children. So families with kids are struggling to keep their young kids entertained, and it's taken a toll on their mental health. So could we maybe host a cooking session for kids where you show kids and their families how to make simple recipes, maybe without an oven or stove, and how kids can make these meals on their own? So so I think we might have some time for Q&A. If there's any questions for me to clarify or clear things up, that's fine. But just to kind of recap a few points from the presentation, and then I'll hand it over. So if you're feeling stuck, try this Think Wrong prompt from today to break through roadblocks. As I mentioned, there's a ton of other examples and exercises that we've used over the course of a number of years now in our creative work. So the hidden talent is just one of many. Thinking Wrong helps you come up with fresh approaches and new possibilities. It uncovers unique insights that you might have missed if you just kind of did your typical approach. And then it's also a good opportunity for you to embrace randomness to drive innovation. So how could cooking or singing karaoke singing country in karaoke, or you know, juggling bowling pins, how can that drive innovation within your company or organization? And then, as I mentioned before, you always want to start crazy, then bring it down from there. At the very beginning of an idea session, you don't want to kind of squash down someone else's idea if it seems too crazy, lofty, or out there. There might be a kernel of something in there, a little nugget of something in there that actually might be worth pursuing. So I'm sure a lot of you have heard the yes and approach. So when you're in these smaller breakout rooms, you want to amplify, you want to elevate these ideas coming from your group members, as opposed to, oh, that'll never work, or we don't have the budget for that, or we don't know who to do that. When you start the idea generation, it's a really precious time for you to continue to uplift and add and plus your group's ideas. So so how can your hidden talent be used as a starting point to come up with fun, innovative ideas to address this COVID-19 pandemic? So that's it for me. Perhaps if there's some, oh, and again, this could be literal or inspired by. Have fun with this stuff. There's definitely no wrong answers in the idea generation phase of all this. And then with that, I will wrap up and perhaps take a few questions if we have time.
Yes, let's take a couple of questions. Yeah, I don't see any questions come up.
One of the questions in the chat was, Mark, maybe you could talk about why you always want to start crazy and then tone it down rather than go the other way.
Yeah, sure. So as I mentioned towards the end of the presentation, there might be something in that crazy idea that you can actually work off of. So so you want to explore as many possibilities as you can without just kind of striking it off your list, like, oh, that'll never work, so let's not even explore something like that. And then with that, you then tend to kind of bring it down and say, okay, what can we actually do now? When you kind of start the other way, when it's just a typical idea, your first idea, it's kind of hard to add a lot of uniqueness or jazz or any sort of like think wrong element off of that, because it's already locked down in this preconceived approach. It's not impossible. It's just I prefer to just start the other way. So that's just my recommendation for you all.
Another question that we had was, can a hidden talent be knowledge of a topic?
Sure. Yeah, definitely. Yeah, so I mean, like I said, there's no wrong answers for hidden talent. It could be something external where it's like cooking or juggling bowling pins, or something more internal like a particular focus in an area, expertise in an area.
Okay, thank you so much, Mark. Thank you for taking us through this activity. We're gonna be using these hidden talents to the next step. So now I'm gonna introduce to you Tito and Eri. We're gonna tell us a little bit about what they do at the COVID Accelerator, as well as how do we go from the lessons learned into team building initiatives in the accelerator itself. Okay.
Hey everybody, good, happy Sunday morning. I'm Tito. I'm here from the COVID Accelerator along with my friend Eri Gentry, and you're here because you're interested in having an impact on COVID solutions, or as one of the facilitators said the other day, you're interested in maybe just feeling better. Maybe you're seeing all these stories and you're trying to figure out how do I contribute to this? And so that's why we created 38 days ago now. We started the COVID Accelerator, which is the idea is how can we help people who are looking to contribute or looking to be a part of the solution? How do we help them find projects and find collaborators and find friends who can work on that stuff with them? So we launched this website called COVID Accelerator, and it quickly grew into a community of entrepreneurs. There are doctors and nurses, of course, but there's also programmers and designers. There's project managers and product managers. There's people working in marketing. There's all these people that, like you, have a professional skill that they work on, and they want to bring that to work for COVID solutions. So I want to share a little bit about how that works, and I really, it's wonderful working with the whole team here, the whole IMAGINEi5 team, the Determinant team, and everybody that's been a part of pulling this whole workshop together. So I love all the think wrong activities and exercises that Mark was describing. I can't emphasize enough how important that is to just ride with whatever comes up, with whatever solutions or ideas that you have, but also to not be too tied to your idea. Having seen so many of these projects start and then some of them take off, but so many don't, or they people come in with an idea or it reforms into something else. It's really about bringing your skills and your passion and your enthusiasm, but don't be super tied to your idea. Like the truth is, your idea probably sucks, and somebody else has probably already thought of it. But I think with the thinking wrong process, you can really start to change that up. And so I want to tell you a bit about some of the projects that we've seen at COVID Accelerator, and how they're thinking wrong about this. So there's 3 projects that I always talk about with COVID Accelerator. It's Hospital Hero, Find COVID Jobs, and Corona Care Card. And so 38 days ago, the creators of these projects, they weren't COVID people. They weren't doctors or nurses or had medical backgrounds, but they were programmers and designers and entrepreneurs, and they wanted to be a part of a solution. So in the case of Hospital Hero, they started out because they had heard, oh, hospitals have equipment, but it's not at the right hospital. So maybe there's a ventilator over here, but it really needs to be over here. So they start, and that's like, wow, that sounds like a smart idea. So they started digging into it, and they very quickly found out that is a terrible idea. Like, hospitals don't want some programmers and designers coming in and trying to mediate, transfer of equipment from one hospital to another. So the Hospital Hero team kept thinking about it, and they figured out, well, what if we could help what if we could help doctors and medical staff with things like getting groceries or pet care or running errands? And so that's actually where they took the idea and kept developing it. So Find COVID Jobs, for example, is another example of helping match people who are looking for jobs in the COVID industry with people who are looking to hire. And then Corona Care Card is helping support small businesses by buying gift cards. So basically you can support a salon by saying, okay, I'll buy a gift card, I'll use it later, but I want to help that business for now. So all those things are really incredible, incredible entrepreneurial spirit is behind them. And I think a real willingness to change your idea and to think wrong. And so I want to share one idea about a project that's just starting out, because I think it's important to figure out what that path is. You don't start with some amazing idea and then you just build it. You start with your skills and your passions and your interests, and you kind of like wind through that journey with the other 900 people that are on COVID Accelerator. So I want to share a story about my friend Step. And Step is working in, before COVID, they're working in making gender neutral, what's that? Oh, they're working making gender neutral sex toys, right? So gender neutral sex toys as a career. And then COVID comes along. It's like, okay, well, I know a lot about manufacturing. So what does Step do? Make masks? No, that's thinking right. Thinking right would be like, let's go make masks. So instead, Step thinks wrong and says, well, how do we make cool, fun, stress balls that are shaped like the COVID virus? So that's the project. It's called Squish the Virus. I think it's a cool example of kind of thinking wrong, which is combining your hidden talents or your other talents and just not doing the thing that seems super obvious. Because for what it's worth, like a lot of people are working on masks. A lot of people are working on manufacturing masks. And so you're all here to be a part of creating new solutions. So I encourage you to think wrong about that. Ari and I will be running around the different breakout rooms. Hi to Ari, she's probably waving. And we look forward to meeting you more. Ari is going to follow up later after the workshop session, and she'll be sharing more about how to join COVID Accelerator.
Now we're gonna help you ideate, and then afterwards we're gonna take you to the act portion of what to do with these ideas. So to start, we have an amazing website that Sarah put together for us, and in this link over here that Sarah is going to be sending you in the chat, you have 3 sections to it. So you have the inform section, the ideate section, and the act section. So in the inform section, you have more information that is going to complement what Dr. Edith has taken us through. So each of the sections are going to talk a little bit more about each of the impacted communities, and in the link you have more information. So going back to our next step is the ideate step. So in here you're going to be seeing the Miro boards for each of your teams and a breakout of the agenda itself. Okay, so we're not gonna be I'm gonna be sending you to the breakout rooms in a minute, and then as soon as you go in, you're gonna identify the room number. Are you gonna click in that link? I know the links are a little bit too close to each other, but you can make sure to click in the right room. Okay. So let me take you to one of the boards to tell you more on how it's gonna look like. Okay, so remember, the goal of what we're trying to do here is to get you to think using your hidden talents on how to produce an actionable idea that can be taken to a COVID Accelerator to the next step. So like to the final product, where the way it's gonna look like is that you're gonna be identifying an opportunity, you're gonna be proposing a solution, you're gonna showing us the next steps and the skills that you need in order to make this happen, okay? So as soon as you arrive in the rooms, you're gonna see a couple of frames that are gonna take you through a process from left to right. You're gonna see the first block is gonna be the hidden talents. So we invite you for each of you to write each of the hidden talents from your team. So by double clicking on a post-it note, you can write smile. If that's your hidden talent or whatever it is that you have. And then from there, you're gonna go into identifying a target population. So you're gonna have mixed groups of people with different target populations at this point, okay? And you're gonna have to choose between, is your solution gonna be solving a problem that is happening now, or is it solving a problem that is happening in the future after, like in the new normal, like after COVID has gone, okay? From there, you're gonna be implementing those into how might we question. So how might we, with our hidden talent, rapidly empower and support the target population to stay safe and healthy during or after the COVID-19 outbreak and into the future. So similar to what Mark took us over, okay? From there, you're gonna like use that question in order to use the first 10 minutes and do some silent brainstorming. So let me say, okay, I'm person number 1. So I'm a creator number 1. So my name is Ali. And then my first idea will be to step in front of my neighbor's window and smile, because that's my hidden talent. So you're gonna go and do that for your 9-10 ideas, as many as you can come up with in the first 10 minutes. We're welcome in this stage for you to like put your brains out, your heart out, and really share the love on the ideas on how we're gonna make a step change in these communities. Okay, so the first 10 minutes. Then from there, you're gonna be sharing ideas quickly. So 10-15 seconds per idea. So you can, so we're gonna go like in circles. So if your group has 5 people, let's say Adri is gonna speak first with the first idea, and then Nico is gonna be telling us his idea, and then Sarah is gonna be sharing her idea, and so on in 10 seconds. So like something quick and short, so we know what you're talking about. And then from there, we're gonna go into voting. So the way it looks like is in the bottom down here, the facilitator is gonna set up the time for 10 minutes of voting, and each person is gonna have 5 votes, and we'll start the voting there. From there, you're gonna take all the ideas that were voted on, so you can highlight and copy them over, so we don't lose the ideas, or you can even move them over as well, okay? And here you're gonna be clustering those ideas into and playing with those ideas in order to get a concept together. So those are for the following 20 minutes. Then you will go into the concept space. So in the concept space, you're gonna put an awesome title for your theme, identify the problem, describe identify the target population and describe the solution, and tell us a little bit of why is this important. So just quick sentences, doesn't have to be a paragraph or an essay. You can also make this board your own. You can add post-it notes, create the squares and concept like a flow sheets. Use it as your team desires, okay? In the bottom down here, the idea is to like identify the steps that you can identify the next steps for your project, okay? And then from there, the last 5 minutes that you have are going to be used to select as a presenter. Then you're gonna have time to prep a 1 to 2 minute pitch of your idea. And then you're gonna have time for a 1 minute of Q&A. So this rapid fire presentation will happen after we conclude this time frame. The next thing that you have to do here is to submit the final idea in our Google Sheet forms, and then exchange your contact information with each other, and join the Slack channel that we're gonna be sending out to you. Okay, so just a quick tips for facilitators are in the bottom left corner as well, in case you need us or you get stuck. You can also call us into the breakout room. So I think we are ready to roll.
one question here, if you don't mind, Adriana.
Yeah.
One of the questions was, do we need to come up with one idea or one how might we statement for the whole group? Or can we brainstorm based on individual talents and then combine?
Yeah, you can combine. So the idea is to combine all of these into one concept for your team. Okay? So does it make sense? Does it answer your question?
And just to follow up on that, you can also, so at the end, you're going to be saving your Miro board. So all your ideas will be on this Miro board. You haven't lost anything. You can always go back to it and utilize it. But it's just an opportunity for you all to bring all your brains together to come up with one idea. Does anybody else have any final questions? If you can put it into the chat before we move on to the breakout room.
Okay, so I'm finalizing the breakout rooms on the back end, so you can answer any questions at this point, and we're almost there.
Okay. Are we just randomly picking teams was one? No, we have assigned you guys based on your interests, but you do not have, so let's just say your target population that you picked was healthcare workers. We assigned you that way into your group, but you do not have to stick with that target population. We want you all to come together to decide what is best, and maybe there's new inspiration now. But that's how we tended to pick you, match you up into teams. Another question is—
So just to clarify in that point, we tried that, but it is not working at this point. So I'm just gonna assign you randomly. Yeah, sorry about that. It is a lot of people.
It's all good. Yeah. So yeah. Random, that's the answer. So let's see what other questions while Adriana's got that going. Isn't the group supposed to vote for the best idea? So you guys, yes, you will have an opportunity to vote on your ideas together, but it's not just one idea. What we encourage you to do is cluster them, cluster all your ideas together. Maybe there's some sort of a trend between all you guys that you're interested in something, and then vote off of that. But it's not just one person's idea. We really encourage you to come collectively and work together to find an idea that works for all of your hidden talents, perhaps, or a few of your hidden talents, or just, I just really highly encourage you to come in with collaboration. But you do get a chance to vote. So there is a voting button here. If you see at the bottom, there's a little thumbs up. That's where the voting is. Let's see what other questions we have. Is there a link to get into the breakout rooms? We're gonna automatically assign you. So you're gonna, in a moment, in a few minutes, you're gonna just get a pop-up. It will say, go to Zoom room XY, like, you know, let's just say 5. You'll just hit yes and you'll automatically join. And you can jump back into our this larger room if you need anything, or you can call us to come into your room. You can call me, Ari, Tito, Adriana, Clarice. I'll put all of our names down here for you. Let's see what else we got. Okay, a lot of things going on here. Let's see. And just to clarify, each room has a facilitator ready. So if there's anything else that you're stuck on, or you don't know, we have one person that we've trained prior to this event to help you all along. And they are a team member, and they're gonna also be working with you to develop ideas. All right, how are we looking, Adriana?
Yeah, let me.
All right, we'll keep going with.
We are good.
All right, we're gonna go ahead and move you guys into your breakout rooms. Yeah, awesome.
Yeah. Okay, right. So you're gonna see a little pop-up, and you're gonna just click on join. Okay, so see you in a little bit, and have fun. Enjoy your time, and let us know if you have any questions.
Yes, and think wrong.
Hello, hello. Getting everyone back. Yay.
What's up? Hey, hey, everybody's all talkative now. Wow.
Nice, nice, nice. Okay, so a lot of really great action from my back end, looking into each of the mirrors and jumping around rooms. So
oh,
that
yeah.
was exciting. Yeah, that was Like a lot of cursors moving around, sticky notes
Oh
moving back and forth.
A lot of fun.
Yeah, great work, everyone. Okay. So,
We had a question for you quickly. There was a number we had to enter at the end and we didn't know what it was.
yeah.
Sorry, do you mind repeating that question?
There was a number before we submitted that we needed to enter. We didn't know what it was, so we just put 14 because we were group 14.
Okay.
Yeah, I think it's that's the team number. Yeah.
Yeah.
Okay. Oh, we did it.
Yeah.
Yay.
Is everybody able to submit their projects? If you can give me a thumbs up, let me know. Everybody was able to submit?
Yes.
Yeah?
Still working on that.
Right, no worries. You
Working
can
on
do that now. You can do that right now while we're hanging out. We have
Yeah.
to let you know about. So yeah, it was like right on the money, right on time. Yeah, we did it like 20 seconds before.
That's right.
Yeah, great job, everybody. We're so happy to be. We're so happy to have you guys be doing this. And so should I go ahead and share my screen here?
Yes.
All right, let me do that.
Mm-hmm.
Go ahead.
So, hi everyone, welcome back, and hope you had a great time in Miro brainstorming session. We are so excited about all those great ideas. So how can we move forward to the next step? IMAGINEi5 and the COVID Accelerator will host a coffee chat next Friday, April 25th at 10 a.m. We would like to invite you to join us, meet up with fellow entrepreneurs and refine ideas through iteration, as well as identify what resources we need to push forward and how we can help you. Please visit our website for details. Let's welcome Ari and Tito to bring us some more details about next steps into the COVID Accelerator.
Thanks, Clarice. So I'm Ari. I'm one of the co-creators of COVID Accelerator, along with Tito, whom you heard from earlier, and he shared some of the great projects that have come out of COVID Accelerator. And projects are happening all of the time, and we're really hoping that some of you are jazzed about being part of this workshop and you want to continue working on ideas. You're probably wondering, do I have to work on this exact idea? What if my teammates don't want to work on it? I feel kind of stuck. That's totally okay. The reason that we created the COVID Accelerator is to serve as a community where you can meet like minds and you can get involved in something no matter what. So don't feel like any challenges you might have experienced so far are a blocker. So I'm gonna just remind you of a few ways that you can get involved after this workshop and keep on doing what you need to do to make COVID-19 a better situation than it is now. So after the workshop, I'm going to invite you to join COVID Accelerator. It's really easy. You're going to go to covidaccelerator.com and you're going to hit the join button. So what does that mean to join? Well, you're going to fill out a quick survey about yourself. So try to be descriptive about your interests and your goals, and that helps us as the organizers kind of match you up to different places. It's important that you be active and not a lurker, because that doesn't really help anyone. So once you're in, meaning once you're in the Slack community that you'll be invited to, you're going to say hi in our introductions channel, and try to say, what are your goals and what do you want to do? And that helps people to be more specific about what help they provide and what responses they provide. And then you're going to find a spot in one of our channels that are called core. So you'll be a core programmer, a core healthcare professional, core designer, or product manager, whatever it is that feels right for you, there's a place for you to join. And that also helps people who are creating projects to find you and to request your skill set. So the whole accelerator is kind of organized around getting project teams built and executed on. And as Clarice mentioned, we are going to be holding a special virtual meeting for you next Friday at 10 a.m. Pacific. And think of that like a projects roundtable or a stand-up meeting. So we want to know if you've made progress on your ideas. And that's a nice milestone for you to hit. What can you do in 5 days that you can report on? But you can also ask for help. So if you say like, I lost my teammates, I need some help there, we're going to help you with that. If you need access to some services, well, we've had a lot of great sponsorships and different tech platforms offer us help. So we can also support you in that way. And I think that's it. It's a lot of information. So you are going to find all of this on our website and on IMAGINEi5's website in the ACT section. If all else fails, chat me up through Zoom, the accelerator, and I will get back to you. So I'll pass it back to IMAGINEi5. Thanks so much for being part of this with us.
Awesome. So before,
thanks, Sarah. It's a great speech. And thank COVID Accelerator for building the COVID-19 response platform, which provides valuable resources for social entrepreneurs and activists, encourage us to team up and put our kind thoughts into action. Sometimes we have this humble thought that we as individuals can only help a limited amount of people. But however, for those people, like your help probably means a lot difference in their life and maybe will change their luck. So thank you. Now let's jump right into the rapid fire idea sharing. Every team will have 2 minutes to present your targeted population and solutions. 1 minute for Q&A. Please follow the link to enter your presentation rooms based on your team number. Team 1 to 10, please stay here, and team 10 to 20, please join presentation room 2. Thank you.
What we're going to do now, oh geez, this is too big, is go through the rapid fire as Clarice mentioned. So in the rapid fire, what we're gonna be doing is each team is gonna have the floor for 2 minutes maximum for them to present their idea. And then you're gonna have 1 minute to answer any questions that everyone will have for you. So I'm going to be on the concept screen for each of you. I'm gonna reset the timer for 3 minutes total, so you can have that in mind. And as soon as the 3 minutes are over, I'm just gonna move into the next screen. Okay, so just keep in mind that's how we're gonna keep it rolling, because we have 20 minutes to go, and we wanna get enough opportunity for everyone to share their ideas. Okay, so let's go. Let's get started with team number 1.
So the idea is based on kind of data sharing between different treatment sites. Part of this was influenced by the fact that I think, like, for my sister who works at Yale New Haven, she said treatment algorithms are constantly evolving, and we're constantly new treatments being tried, like plasma infusion, antibody-based therapies for interleukin-6 knockdown. And so I think having a way to pool that data together would make it more effective for doctors who are trying to develop new strategies, especially when it comes to people who are like seeing severe cytokine storm. So yeah, I mean, I think another thing that could be really powerful is when you're having studies that can comprise of maybe like N groups up to 2,000, you can have better statistical outcomes, and not outcomes, but like you can say with higher statistical confidence or not whether treatment is more effective given patients displaying certain comorbidities or whatnot. Obviously, there are probably a lot of obstacles that we would face, such as kind of existing electronic health records, like Epic health care systems might be not inclined to play very well. The obvious issue is also with data privacy in general. So when we do this kind of work, there'd also have to be a lot of work done to make sure that the data scrubbing is pretty good. I mean, there's still certain parameters that we'd like to have, like patient age, comorbidity, gender, what time the treatment is administered, which treatment, what the dose is. But the idea is basically to have all these kind of things pooled together so doctors can help optimize what treatment to use.
Cool, thank you, Andrew. Does anyone have any ideas? Any questions for Andrew? And feel free to write them in the chat so that we can keep a tab and we can communicate them afterwards as well.
I have a quick question. How will it work, Andrew? How will the idea work?
Yeah, so I'm imagining we set up a website with some good front-end developers. There'd be a site where you can input the data for each kind of hospital or treatment site. And then you kind of input this patient is using this treatment. They're the parameters per patient. I think there's definitely like a manual labor kind of aspect to it where ideally you could maybe automate some of that procedure, but you just have a website or some other kind of a very secure website, hopefully, and then we have them pull the data together, and then doctors can check it constantly to see what's being developed.
Go ahead. Who's gonna speak?
So we initially landed on unemployed individuals and the older generation, and we were thinking of how can we help older folks who are basically getting laid off because of COVID, but aren't able to get reemployed because of ageism. And how can we connect them, kids that are isolated and idle, or maybe can't go to daycare, after school programs, or school, and so the parents are struggling between entertaining the kids, teaching the kids. And so how can we introduce this older generation, Gen Xers and baby boomers who are unemployed but need to work but can't necessarily work? And so we were thinking of a way, probably through a platform ultimately, but just starting with an organization that connects vetted baby boomers and Gen Xers that have skills or are able to not necessarily babysit, but virtually engage with these kids. And so we were picturing having different profiles for the the mentors. Maybe Aunt Sue's really good at gardening, Uncle Rick is really good with fitness, Grandpa Joe is like an astrophysicist, and connecting them with the kids so that they can maybe do like an hour session and producing a marketplace where the kids could browse, like say 2 to 3 p.m. every day or once a week or whatever it is. They can browse through their favorite folks who present this content, and then the folks who are presenting it maybe on the back end can get paid either through it being a subsidized program or a nonprofit or grants, or even the parents paying directly themselves because they're not able to do in-person after-school programs and tutoring and whatnot.
So team number 4.
Okay, that's me. Hi, Elizabeth. So we, yeah, let me
restart your time.
Okay, there we go. Okay, so our idea was that there are lots of unemployed people who are becoming newly unemployed or have been unemployed before, and this is a particularly difficult time to job search, while at the same time there are lots of people hiring. You see these job listings of hundreds of thousands of people hiring, and so some sort of a way to help match those. So one website or an app that integrates all of these massive job lists and makes them discoverable. So a discovery platform that will help sort them, but then also help people discover their hidden talents, help inspire them to think, oh, I could do that kind of a job. So showcasing examples and inspiring case studies. And then also we started thinking about some of the ancillary services that are necessary to help just bridge these two groups, right? And so things like background checks, you know, if they need a car, maybe matching them with these, you know, zip car kind of things, so they could be delivery people. and sort of trying to try to break down some of the barriers of getting these massive number of people unemployed into, you know, some of these are short-term jobs. One idea that we had about kind of circumventing the background check idea was, you know, around the peer review, kind of like LinkedIn has, but something where you could, you know, rather than through resumes and the more formal ways, whether you could have some sort of a system where people vote or support their friend and say, yes, this is somebody that you should hire. And even went into the idea of maybe you did a crowdfunding where you get your friends to all crowdfund to guarantee your first week or two worth of the salary to the company if the company doesn't believe that you, you know, ended up serving their purpose. And so some sort of a way to have the crowd get you over that hump of getting into that job quicker, earning that trust without having to do all the time-consuming, background checks and resume searches and all that kind of stuff, and just try to speed date, so to speak, and get people placed into these huge quantities of jobs that are out there. So we also realized that Find COVID Jobs is already a COVID Accelerator company, and that there might be some synergies to help boost what they're already trying to do.
Okay.
I just had a comment.
Yeah.
I just had a thought. I wonder if just with the way recruiting system is based on commission, I wonder if we could rethink how recruitment works and therefore make it more equitable to sort of anybody who's looking for a position, and incentivize them to participate in this.
Yeah, that's a really cool idea. So let's continue that conversation through the chat, and then we can figure out, maybe we can take it into the accelerator as well, and make it something bigger. Okay. Let's hear from team number 5.
Hi guys, my name's Riley, and I'll be talking for team number 5. So our idea is called Messages for Medical Workers. So the problem that we identified was that we currently have a large number of medical workers that are very run down and exhausted and feeling kind of hopeless in this time, as, you know, can be expected. And then we also have a large general population that feels hopeless but wants to do something but doesn't know what they can do because they're trapped at home. And so the concept idea is that we wanted to provide a way for the general public to provide encouragement and support to these healthcare workers. So whether that is through messages or videos or photos. So kind of the platform that we would use to do this is we would start out by like mass emailing hospitals and clinics and things like that, and having doctors sign up for a essentially email subscription service. Then we would create a public facing website that people can post messages and videos on. Then, you know, using social media to advertise this so that people actually go and post. And then from there, we would have like a voting and flagging system. So the voting system being essentially like liking the messages, and then flagging being if someone were to post something inappropriate, they could flag that and we would be able to go in and manually take it down. So then from there, we would have the website automatically send emails of the most liked posts from the day before to these doctors, so that every morning as they're going into their shift, they get these emails essentially encouraging them as they're going in. So this both allows the population to feel like they're helping in some way, and also allowing doctors to see this mass support from all over the world. Are there any questions?
Yeah, any questions from anyone? That is amazing, because based on what Dr. Edith said in her talk as well, like there is a lot of connection to, the need for emotional support in order to like balance and support, like for them to be able to support the community as a whole. So that's a really great idea.
Thank you.
Team number 6.
All right. Hi, everyone. I'm Stephanie.
Oh, I'll wait until the timer starts, I guess.
You can start speaking. It's okay.
All right. My group focused on unemployed workers. We identified that there's many problems with unemployment right now. High numbers, unemployed workers having a hard time figuring out what benefits they can get. But a lot of the group that was impacted were just the low income workers who are now out of work and really need to find jobs quickly. So we came up with this concept of like a matchmaking service, if you will, to help train workers in new skills and connect them to funders and mentors. So we have a couple of user groups in terms of this. We have the unemployed worker who's looking to obtain some new skills to get back into the workforce, and they would be able to find resources in this solution and also link to mentors. So these mentors are people who are already in the industry as coaches to trainers to help develop those professional skills. So we would be linking those two together. And we also wanted to bring in the concept of donors or funders for this endeavor. A lot of coaches may be currently out of work right now. So if anyone has maybe a stimulus check that they didn't necessarily need and are willing to donate, or anyone who's willing to donate in general, it just wouldn't be limited to those with stimulus checks, to help in a way sponsor these mentors to increase their reach and commit more time to training people who are currently unemployed to get them back into the workforce. And with a site that is able to include all of these people already, we wanted to give local businesses as well the opportunity to be able to see who's learning what skill and see if there are any matches there that they can bring these newly trained employees on board to help speed up that process, so they don't have to go through those official channels of applying for jobs. And they can either be hired as an employee right off the bat, or maybe even get some apprenticeship opportunities to hone these new skills as they re-enter the workforce.
Awesome.
Any questions?
So I see a question from Heather on the chat. So are most of the unemployed in retail service industry, or do they want to move towards white collar work?
Honestly, I would prefer to do some user testing to answer that question. I don't really know off the bat, but I do think that there's a sense of insecurity right now in some positions, and that some employees might be interested in like transitioning into roles that they feel a little bit more secure in. And that could be a great opportunity for those people.
Yeah, that would be a perfect next step into how do we really manage the actual need and everything that we have in our communities. Okay,
absolutely.
Thank you so much, Stephanie. Team 7.
Hi guys, this is Rina from Team 7. We have a doctor on board, a couple of technologists, and 2 social entrepreneurs. So, right off the bat, we all agreed that we are going to, find some solutioning for underserved populations. We gravitated towards finding, combining our artistic and fun side to the current problems. So the concept is, how might we, with our combined talents, rapidly empower and support affected individuals to stay safe and healthy during COVID-19 outbreak and in the future? So it's both for current as well as future. Regardless of demography and population, we feel that everyone will be struggling with some aspect of disruption in what used to be regular pre-COVID life. So our idea is to build a multidimensional virtual friend and advisor for the affected population, helping various and support various needs. So we will be trying to create a virtual friend and advisor. So basically, we will be identifying people who can provide services like, outreach or music or lessons or coaching or just pick me up kind of exercise or conversations. So it'll be a platform that will help bring together people who are seeking help with people who can support those needs on a skills, socialization, and enrichment ideas. So if you see on my screen here, we have how does the idea work in steps? We will understand, from the population, what it is that they need, understand, how we can build the platform with features like, hold on one second, a mental health, a wellness counselor, a virtual healthcare consultant, top 10 easy exercises, virtual cooking sessions, or a virtual friend for any population, helping learn a skill, or just sharing life experiences. The elderly population, all the families right now are seeing the need and the value that different generations bring to each other. So helping connect that will through a platform, will be very uplifting for our target population.
Yeah. Okay, Rena, thank you very much. I'm from Team 9.
Yes, I can speak for Team 9.
Okay.
So our team decided to focus, we didn't have time to improve the formatting here, but basically our patient that we were, or our community that we were targeting was healthcare workers. And the problem that we identified, and the one we chose to focus on, was the fact that healthcare workers are in a kind of constant state of stress. We had someone in our group that's friends with someone that works in a hospital, and he mentioned how, they're essentially all day, they're just in this super stressful environment. And so that was our kind of problem statement, if you will. And we came up with a bunch of different solutions around this area, but really what we tried to distill it into was a way to deliver what we're, high level calling gifts to healthcare workers that can help them de-stress while they're in this super high stress environment daily. And so why is that important? I mean, it's important because the care of all these patients that are affected by COVID is highly dependent on the ability of healthcare workers to continue doing their jobs and stay sane throughout their days. So in terms of how this idea would work in steps, we would, I think, recruit volunteers for this project across kind of major cities. And then we would identify local hospitals for each hub or volunteer. And then we would find a way to fundraise. So I think we would just kind of identify what the best way of fundraising this project would be. And then we would gather those donations and then go shopping. So the kinds of ideas or kinds of gifts that we were thinking of were, for example, books and games that we could bring to hospitals, such that healthcare workers on their breaks, whenever they have their 20-minute lunch or 15-minute break, they can go to their break rooms and have an area where they can maybe have a distraction from the daily grind and the stresses of their actual work. The other one was shoe insoles. So one thought that we had was, they're on their feet all day. What if we kind of delivered these nice insoles that they can replace with shoes, and suddenly, hopefully, the fact that they're on their feet all day, it won't hurt as much because they'll have some fresh, soft, comfy insoles. And then, so we would need volunteers for this, obviously, and the final step would be just to deliver these gifts to local hospitals. So it's a simple idea. It doesn't require much tech or anything like that. It's really more about energy and finding people who are interested in helping with this.
Yeah, that's a great point. Thank you, Nikhil.
Mm-hmm.
I think we've run out of time for your questions, but pose them. Well, if you have any, does anyone have any quick questions?
Hi, I'm Disha, and I'll be presenting for Team 10. So basically, we wanted to focus on children, on families with children. It usually takes like a village to raise children, and then suddenly with staying inside, that's kind of removed. So we thought that we would try to create this platform which helps parents who are juggling with the additional responsibilities of having to homeschool and keep their children entertained, and also work from home at the same time. So what we are trying to do is that we are trying to create this thing where parents, educators, childcare professionals can host live sessions that are educational, active, or include creative activities using channels, and they can use their special talents and hopefully create some fun activities. And so we will want to start off with parents creating this group of other parents that they trust, and parents who have people who have special interests, and childcare professionals who are looking for who are looking to contribute their time. And they would try to create this schedule where the parents go okay, they are free for a certain time block, and some other parents are free for some other time blocks. And parents are provided with training and tools so that they can, maybe hone their talents or develop them, or they can provide kits and stuff that children at home can work with. And same for local childcare educators, etc. And can create this safe platform where children can also join in, and they can join into these live sessions at particular time points to participate in these activities. And maybe we can have some challenges and competitions leading off of that to keep children engaged. And there can be a tutoring session, homework help, and all of these that can also be involved in this platform with different channels.
Nice.
So that is what we had.
You can start
Michael, Yara, Arjun, Juan, and I worked together because we noted a problem that we noticed was there was a lot of misinformation about what coronavirus is, what you're being asked to do, and what you can do to help your own health. And so our idea was to create a platform that primarily uses social media because we noticed that young people and immigrant families especially were struggling with getting accurate information, where local doctors as well as local governments can give information that's relevant to you, and have retired physicians who still have medical knowledge but are not currently practicing in the field to upvote or downvote posts so that you can get more verified information. So this is important because there's a lot of misinformation right now, and people don't know the best way to keep themselves or their community safe. And local doctors are pretty swamped with what to do. And right now in the United States, there is this culture of not trusting larger institutions. So we thought a platform that's based on local knowledge from local doctors and local governments, that's verified by people who have MDs in virology or immunology, and that's accessible in a way that younger generations who have not done a great job of following COVID-19 social distancing rules and other populations that are struggling to understand the current rules can get more specific local information. And so this is somewhat similar. I think Team 7 and Team 3, they both had some sort of upvoting, and they also had sharing medical information from local doctors. So in some ways, our idea is also similar to them.
Which is awesome, because now you get to iterate it between all of you guys, potentially, if you want to continue going into the next stages of our program. So that's pretty awesome to hear, all the different ideas that you guys have coming up. So we have gone through all of the 10 teams.
I just had a question about recruitment of students who want to participate. What students do you think would want to sign up for this? And also, did you have an age, or is it all students?
So it's all students. It doesn't matter if they're very young or college students, PhDs. Any student who's experiencing some kind of emotional distress and feel like they need something specific, instead of waiting for a solution to just appear in front of them, could participate to these kind of workshops and find a solution for themselves.
Team 12 presentation.
All right, so the name of our concept is Essential Events. So there are currently resources for healthcare workers that revolve around different donations, whether they're events, therapeutic resources, and things like that. But it's really difficult to locate and navigate. There's no real central area for information, and people aren't always able to contribute even when they want to. So say you have something that you would like to contribute to the community, sometimes there's no real way to get connected in that sense. So the next step, I guess, would be providing a place for healthcare workers, event promoters, and the public to connect with the resources within their community. The resources that we're kind of focusing on were free tickets for events post-COVID, as well as therapeutic resources to help with the collective trauma of healthcare workers in the field right now. So why is this something that's important? Healthcare workers have been under a lot of stress. This would provide them an easy and efficient outlet and provide them the available donated and discounted items in a single location. So how this would work was that we'd create a website. This would allow people that wish to donate these events and therapeutic resources to healthcare workers. The healthcare workers could explore this site, verify their identity as a healthcare worker, and then obtain these free items or donations. So this would also integrate with different vendor platforms for people that are trying to already provide these donated goods. Since there are so many options out there, it's really hard to kind of get all that information in one place. And that's kind of the end goal here, is to make it uniform.
Then have you guys thought about all of the companies that are currently in existence? Or like, would you find an importance to connect those people and those things that already exist? Or are you looking to completely create a new MVP?
So that was something that we actually talked about, was like, if we wanted it to just be like an area where you could dump information or actually be able to obtain things. And it was kind of like a combination of the two, where, you know, if someone within your community wanted to donate season tickets to a soccer game or whatever it is, that people could actually do it that way. But there are a lot of already existing options. So trying to integrate those within kind of like a one-on-one platform like that.
Oh, hey, I love the idea of like event tickets or something. I was wondering, like, I'm not part of the medical community, but do they have like a favorite like theme song or like playlist or something? Because you could go out and get that band to donate like their shows. So that was just something I was thinking about, was like, is there a specific song that you could get, or like a specific band you could get that would be like really like healthcare workers would be like, fuck yeah.
That's actually a good idea. We could like poll people and see you know, what interests them, and then you could try and get them to donate tickets in that way. That would be really cool.
Let's move on to Team 13.
Nurturing neighborhoods is targeted to isolated individuals. We made the observation that people in neighborhoods are physically close but socially distant, and we kind of want to make them socially close. So it's about creating a network within your 4 or 5, 10 block at most radius, and helping nurture those neighborhoods so that you know, people can support each other in this crisis and in future crises. And certainly they can do shared activities, maybe even some outdoor activities, not physically close, but, you know, physically distant, shared walks. Murals in the neighborhood, murals on the road, that kind of thing, a way to get people socially closer when they're already physically close, and they can identify each other's needs. You know, you can see what children are in trouble once you get to know their family, and you know, you can find out who's lost their job. And
I'll just say that I think that's a great idea, because like, let's just say your neighbor needs, you know, they can't get out and they need groceries, you know, you can go in and they can let you know through this community, and you'll go pick it up for them. So I think this is quite useful. Great job.
I have a question. How could you combat like online bullying or cyberbullying with your app? Like, how would you address those issues?
I think that and some other issues need to be addressed kind of like with a guiding voice within the app. So we don't just want to introduce people We want to give them kind of ideas of how to connect and ideas of how to watch out for each other and ideas of what to look out for, because anytime you build an online community or a physical community, you have to watch out for people who are looking to target vulnerable people, and that's just life. So there has to be kind of an instructive voice in the app.
So I have a question. If you guys heard of a platform called Nextdoor, and how is it different?
So this is different because it's smaller scale. So we're looking at, neighborhoods like your HOA, not necessarily your larger. I think Nextdoor app covers a larger physical distance than what we're talking about. We're talking about your next door neighbors and their next door neighbors and their next door neighbors, not the person 10 miles away from you.
Actually, Nextdoor is called hyper-local, so it's like on your street. I mean, they're worldwide, or I guess nationwide, but the focus is that you subscribe to like.
Yeah, and we would need to explore that. I mean, I've certainly heard of Nextdoor, but I know that, for instance, Nextdoor is great when you lose your dog, and it's great when.
Right.
But it's not necessarily, not everyone is using it. And one of the things that I'm thinking is urban environments might not necessarily be using it as much as suburban environments. So one of the things we want to do is we want to connect with politicians and local community leaders to kind of get this out there as part of our marketing initiative. So it's not just suburban communities that are using it.
Okay.
Thank you. So next one, let's move to Team 14, sharing connections for elderly isolation.
So I'm Vin with Team 14, and our idea is sharing connections. So basically, the problem that we wanted to work on was elderly isolation. We saw some common needs between sort of the elderly population and isolated individuals, so we kind of brought them together. And our idea is a platform that would help people connect, and that connection, sort of an online space, could take a lot of different forms. It could be asynchronous, like posting a bulletin board, a forum, that kind of thing, or an actual real-time experience with someone, maybe sitting down and just having coffee virtually, maybe making dinner together, something like that, or sharing a story. And so it entertains the opportunity for a lot of different types of connection with people. And we also want to give people the opportunity to get certain support services that they might need, even within their own local community. Something like getting medicine or getting groceries, or having like a dog walking service, something like that within their community. We think this is important because it obviously helps provide support to these people. It reduces loneliness. Dr. Edith shared out about social determinants of health, and we think like this solution could help in that respect. And also just overall for creating a learning environment and social experiences for people. So yeah, I mean, the way this would work, we'd have a platform. People would connect, and you could set your preferences on how to connect, maybe based on your interests, maybe based on your past experience. And then however you want to go about interacting with people, either real time or asynchronously, you can set those options and then work from there.
Are you planning to use an existing platform, or building a new one, or something specialized, or?
Yeah, good question. It's not something we really went into as a group, but I think we'd want to look at, I guess, the pros and cons there, right? I think you could maybe scale a little bit more by leveraging a platform, but maybe have a bit more control or more of a tailored experience, potentially design it a little bit more around the customer if we maybe built it. So that's interesting. Thanks for that.
So then can I ask, is there specific for a neighborhood, or it's for a wider range?
So we see the online space being pretty broad, you know, nationwide or even broader than that, but we'd like to have opportunities to localize the interactions and the support that you might get.
Okay. Let's move forward to Team 15. What aware?
I'm representing Team 15. We have sort of a working title, World Aware. Although since we're focusing on kids, that might need to be workshopped a little bit to be a bit more kid-friendly. But the basic focus that we were interested in is sort of in the here and now. We have a lot of people who have to go to work, who have children. And so that includes healthcare workers, that also includes other essential services as well. And so the parents are struggling with having the kids at home, but also the kids are struggling. And this goes to some of what Dr. Edith was talking about this morning with trauma. So there's kids can recognize that there's a lot going on. Their parents are very stressed, but they may not have all of the information about what's going on and how to process it. So we want to sort of combine both of these problems into one solution. And we want to develop sort of a virtual edutainment or entertainment system that can have programming for the children that will, of course, keep them entertained, but also provide structured activities such as plays or becoming superheroes. They can all travel to a location, eat some, make some local food, or they can take on the roles of their parents for a day, and then the parents can be kids, role reversal. But all of this will be also have an additional bonus and additional structure around mitigating the effects of stress and trauma, both for the parents and for the children, and especially for the children who may not be entirely aware of what's going on. And so in order to implement this, we believe this will probably start out as sort of an internet-based platform. We want to start, this is for the here and now, but potentially it could branch off. We want to identify problem area, the target users, do some empathizing, figure out what exactly types of activities they want to do, build a solution around that, and then also transition that into a platform with psychologists, with people from education who can partner with us to provide these services.
Great, thank you, Aaron. So is that a platform for kids, or it's a platform for parents, or it's for both?
Yeah, so I think the one of the main focuses is to make sure that kids have things to do, to free up the parent of generate things to do at home with their children. But the other bonus would be that kids could also start processing some of the things that are happening. I think that it's open to sort of having things that themselves, you know, or things they can do with their parents in the room together. I think that's pretty open-ended.
Thank you. So let's see, any other questions for Aaron?
Aaron, I have a quick question for you if you don't mind.
Sure, no problem.
Thanks. Do you mind kind of telling me about some of the thinking wrong, I guess, skills that you guys identified and how you would incorporate it into this vision for
what types of skills were you thinking of?
Oh yeah, like your
What do you
hidden
mean?
talents. Like for example, you had identified hidden talents during the thinking wrong.
I think sort of in terms of like the thought process here, I think what basically happened was we knew that we wanted to focus on the issue of families with children. And then several of us had sort of either performance-based like music or acting components. But we were also inspired by what we heard earlier today with Dr. Edith talking about you know, the issues related to trauma. And one of the inspirations I had personally was I know about this Center for Children who've lost a family member who's died, and they have to help those children understand what's happened in real terms. They don't sort of sugarcoat it, but they also sort of have like a utopia of like a play space for kids to be kids too. So it's pairing both of those things, and this is kind of like a virtual implementation of that. That's kind of where this came from.
Small business supporting 16.
Our idea was so recently with the $2 trillion stimulus package that was recently announced by the government to support the economy, there was a small part of it that was targeted towards small businesses through the Paycheck Protection Program and through the business stimulus package, which is in the hundreds of millions of dollars, and it ran out really quickly. But the problem was that it mostly went to small businesses that were small, but that still had a lot of resources and connections, like Potbellies and like all these franchises that still had a lot of lawyers and people who could help them fill out like the complex application. So a lot of the money went to people who did not necessarily need the money, and a lot of the small businesses, like the barber shops and like the restaurants, like the yoga shops and whatever, they did not get the opportunity to fill out the application, first of all because it was so complex, and they were overwhelmed, and they did not have sort of the support or the resources to fill out such a complex application. And so we decided, so since the money for this program's run out since then, and they're planning to sort of revamp it and refund it soon, we decided to create a resource through a website and an app to provide information and like step-by-step instructions for small businesses that do not have the that need instructions and who are confused about the application process to get money from the small business stimulus package. So it'll be like instructions, and it'll also be interviews and profiles from small business owners who've been able to successfully fill out the application. So it's basically just to help small business owners navigate through the sort of the intricacies of the application process, and hopefully get their loans, and to clear up like any misinformation about the program, and to help them like get their money and survive this pandemic.
Thank you. Okay, so it's a website for information, right? Do that also provide consulting service for a small business? Or?
So it'll be both, information, and we were thinking also like interviews and like profiles from people who've already gone through it, all the small business owners, so they can sort of mentor each other. And we want to start kind of very small, because there are tens of millions of small businesses out there. So we were thinking about starting with like barber shops and hair salons, just as a starting point, and going from there.
Yeah, it can compensate salary, which is pretty good. So I will leave the opportunity for question for someone else. Any other questions? Team 17, we have 2 minutes for presentation. Who's from Team 17, please?
Right here, Jessica. We worked on Contribute.to, which is a platform that collects contributions, financial contributions for people impacted and small businesses impacted by COVID, and helps distribute those contributions. And what we were discussing during the ideation phase is the other ways in which we could help support those people who end up on our platform, because the platform is very flexible. You can be an artist and contributions. You can be a freelancer, performing artist, you name it, right? So something that the people impacted most by COVID kind of have in common is that they tend not to be in highly technical careers that are easier to move online and are better positioned to work remotely. So we were thinking about how they may not necessarily have the technical skills or tools to produce their own digital content, and how, in addition to helping them collect contributions, people could also contribute their skills to them as well. So instead of just getting monetary donations for what they do, a developer could get on there and say like, hey, I want to help you make a site to help promote your work, or a video. Go on there and be like, I want to help you tell your story. And then we also have patrons who want to match the contributions and the financial contributions made through the platform.
Okay. Okay, so it's like a half freelancer, like a free freelancer, half donation, right? Is that...
If by that you mean it's a double-sided marketplace where we have the people who need the contributions who want to collect contributions, and they could be anything. It could be small businesses, they could be small organizations, individuals, and then you have the contributors on the other side and the patrons who want to match those contributions.
Okay, yeah.
Is it a one-way street, or the contributors actually getting something in return?
So the donors. That was something that we brought up during the conversation, is what is something that is low cost that the recipient can do in return for the contribution. The interesting thing about the platform is we have support from a fintech company that is one of the few fintech companies able to receive microtransactions. They've figured out a way to make it cost effective. So we're talking, people can contribute almost any amount, right? Like you can even do very small amounts. So things that would still feel good to you, even though you're only contributing such a small amount, like what can that person do to make you feel more connected to them or contributing to them? The specific category we're working with were artists. So one of the things we talked about artists could do is, you know, send you a follow-up message or do a shout out to you on social media. Of course, for greater donations, that could be another level of something they do, but we're not trying to put a huge burden on the people who are on the platform to receive contributions. It's not open to anyone to just get onto the platform and receive contributions. These people have been invited by essentially a curator, so of an organization. Let's say, you know, COVID Accelerator is an organization and they've deemed certain people or projects worthy of receiving contributions, and they are confident enough in these people that they're willing to have their organization name associated with them, then you'd be able to go onto their contribute.to/COVID Accelerator page and contribute to the projects within that collection.
Okay, let's move on to Team 18, Virtual Reality Skill Learning Bootcamp.
Hey, that's me right there.
Hi.
All right, so I'll start off. So yeah, one of our skills was like, we were a team of designers and some virtual reality experience. So the problem that we saw was we're going to be heading into like unprecedented times of unemployment. We had like 16 million people, I think last week, file for unemployment, and way more that are actually unemployed. And then our team kind of, from personal experience, saw that the biggest thing that's going to be missing when people try to find a new job in the coming months is networking. So they're not going to be able to be in like a physical room with their job interviewers and stuff like that. They won't be able to like easily learn those new skills that they need to find those jobs. So we decided to put virtual reality in the mix here. Basically, we're taking the bootcamp process of like, basically you have some tuition, and then there's like a 6 to 12 week course. And then at the end of it, usually these boot camps have like guaranteed jobs. So basically, if you don't get a job, you get like a certain portion of your tuition back. So the way that we're kind of thinking about it is you team up the companies and the boot camps together, and have the boot camps provide, like boot camps or universities provide virtual reality headsets to each individual student. Then you would conduct classes within virtual reality. You would have virtual reality mock job interviews. Then in the last week or two, you would host a job fair with all the participating companies. And those companies would then directly, using the same app, conduct those job interviews. This might seem like a little pie in the sky, but these applications already exist. You can definitely repurpose them for this use. So I think a lot of this idea would be coordinating these bootcamp companies and universities with real world companies. And yeah, that's our idea.
Hey, I love this idea. I love the specificity of how you started with virtual reality and use that as a constraint. Just because it's so easy to try to like solve every problem out there, and it's just, you've clearly picked virtual reality. Can you walk me through a little bit, like how'd you like, was this, like, yeah, how'd you come up with this? Like, what was your process from like the thinking wrong in the beginning through, like, can you maybe share a little bit about how this formed?
Yeah, basically, we had like a bunch of ideas, a lot of pie in the sky ideas as well. And the problem was kind of like not everyone has virtual reality. So we started off with like a seed idea of like, well, how do we get the subset of people we want to actually use the virtual reality headsets? And it had to be like a self-contained system, we thought, in order to actually have everyone be able to participate. In the future, though, I think this could be a great idea of like, everyone should be essentially on a platform like this once the headsets are prevalent.
Hey, this is Ari. Great work. I have a question that's a little bit out there, but can you imagine jobs that exist only in VR? Did that come up?
It did actually. If you scroll a little bit to the left, we had a new industry practices section, and those are basically jobs built specifically for VR. We had, house hunting in VR. We had VR salesmen, like basically put Amazon into a virtual shopping experience where you could actually have literal salesmen or people helping you find the products that you need. We even had like ideas about VR sex workers. So yeah, there's like a lot of different ideas you can do with that. The main problem, I think, why we didn't go in that direction is like virtual reality is not prevalent right now. So we kind of tried to have like that closed system where everyone in that system would have a virtual reality headset to start off with.
So I have a question, or maybe more of a comment. When I was doing my master's degree in Germany, I remember there was a virtual job career fair. So they actually had, it was like 10 years ago or even more. They actually had like a rudimentary VR without a headset, but you could like log in and walk around on the screen and virtually like walk up to somebody's booth in that VR and start asking questions about jobs and have like an interview. You might want to see what their experience was.
Are they still
I'll need
around?
to check what the link is. I couldn't find the link right now. Maybe they are out of business.
Yeah,
but I can do some research.
Definitely let us know. That'd be great. All right.
So let's move forward to team 19.
Okay, so we started off with the target group that we wanted to focus on, which is isolated individuals and unemployed individuals. And we thought of mixing these two groups together in an ISO cafe. Basically, the idea is creating this platform where people can reach out to if they need a skill, or the other way around, people that have skills and they want to share, they can be active on that platform. We saw it as a way to tackle isolation, mental health, kind of solving things that you would normally do in person with other people. You can do it online, learn new skills, or even conduct workshops. So I think one seed of this idea came from sharing your hidden talents. So this would be one of those where, say, I would want to learn coding, but I can go to a class and I don't necessarily am attracted to learning, reading on a website. Having somebody on in real time on video classes with online would be much more motivating and reduce the isolation side effects. This platform would connect with online social medias like Facebook and LinkedIn, maybe, where it can automatically draw in groups of people. You can you can filter or sort by skill. You can offer create your profile, and it would also be a resource for other options, recorded sessions, or linking to other online.
I actually have just like one quick question. You may have already stated this, but is this for right now, currently, or is this going to be something more that would affect like the after the pandemic, or maybe both? I didn't know if there was like any
Yeah, we thought about that question, and I think this would be of very much use right now, I think, but there's no reason, we didn't find any reason why it wouldn't carry on afterwards. Also, we were thinking that skills that you can learn there or now, you can use after the crisis as well, maybe even in job seeking or, you know, lifelong skills that you learn.
Yeah, no, I think that would be great too, because, you know, like anyone that would be interested in taking on this project, they'd want to be able to probably take it to the next level. So that, I think that's really cool.
Yeah, we thought of it kind of like an online collaborative board where, yeah.
Shout out to Team 20 members. I hope you're all there. Thanks for a great brainstorming session. So our project is called Wiki Coach, and the idea is to have a peer-to-peer self-help community, like a Wikipedia style. But instead of working on an article, like a community would work on creating a great article, community here would work on challenges and solutions to a specific problem that an individual would have. So let's say somebody's feeling down, they are not motivated enough, and they need some guidance. So we can have a community pitch in and provide ideas, what they can do for fun, how they can maximize their performance in general, what skills they can learn, what games, what interactivity they can engage in. And overall, the concept is to sort of create a mishmash of Quora, Wikipedia with like a life coach type of service that would not be a specific, like it wouldn't be one-to-one, it would be many-to-many. So if you see somebody struggling with, you know, in an area that you're very interested in and you went through the same thing, you can sort of pitch in and provide your suggestions. And then the idea is to create, a community would sort of select the best practices, best ideas get uploaded, and then as a contributor to this community, you get rewards, and you can even potentially develop this as a new career or sort of a side career for you. But the overall idea is to have sort of peer-to-peer community help to motivate and maximize your performance. Yes, and one more point, I see there are quite a few related or aligned projects. Perhaps we can consider merging.
Awesome. All right, guys. So again, maybe we can just finalize everything here. We're really, really happy to have you guys here, and we're glad that you went through an extreme version of like creativity compacted, right? I think that's what's important, is that we do create that initial spark of how can we best support our communities, and that gets us going, gets us thinking, and also it allowed you guys to get to know different team members that are going to be on the COVID Accelerator. So we hope that you'll continue your ideas, or if you have even more spark, that you'll connect with your teammates and that you can follow up with us on this coming Friday at 10 a.m. PST for the coffee chat. We're just gonna ask that you kind of give us an update where you're at with your project. If you haven't moved forward but you need some help, it's okay, come anyways, and we're gonna help you. We're gonna figure out how we can get you those resources or match you up with the right people. And then also we're just gonna send an email out to finalize everything. And again, I wanna thank you guys for being so committed to helping our communities, and thank you to our speakers, and our special thanks to our facilitators. You guys are the ones that really made your team extra special, because you helped them push forward. So anything else, any other final comments? Maybe you guys can shout out how you feel now afterwards, and then we can kind of close out.
The next steps are to meet each other in the IMAGINEi5 and get started in the IMAGINEi5 class for the COVID Accelerator team. So we invite you to come and join us in the coffee chat. It will be on April 24 at 10 a.m. So you will need to just sign up to the COVID Accelerator. .com in order to get all of the links for the next steps, but we'll be seeing each other soon. You can also find this information in the ACT portion of our website. So there's a lot of really great resources there, but I invite you to connect with each other, to make sure that you log into COVID Accelerator if you want to take your idea to the next levels. And yeah, join us. We're super excited. There's so many great ideas. I'm just wondering what the other teams from 11 to 20 came up with, and then we'll be sharing all of these ideas in a deck with all of the participants. You will be seeing the end results in a deck and in the website as well. So thank you so much for joining us. It was an amazing time. Do you guys have fun? I had a lot of fun seeing so many ideas come up, and yeah, it was super exciting for me. So
I'd love to share something. This is Ari, COVID Accelerator team, and I wanted to respond to the question about coffee and COVID. This is something that we host every single day. So a lot of new people join, or some people are feeling like lonely or isolated, so they join us. And so you can find us there 10 a.m. PST every day. The Zoom link goes out every day in Slack. The one that we're hosting on Friday is extra special just for you all, so that we can do a project roundtable. And even on weekends, yeah, every day means every day, because I don't know what day it is during the pandemic. So we'll be there. And otherwise, we're always in Slack, and a lot of these questions can be answered there. And the other comment I think it's really important to address is half of these projects can be combined into one. Totally. That's what happens. Like, that's part of the reason that we created the accelerator too, is everybody wants to solve the same problems, and they think of the easiest first solution. And that's classic thinking right. Thinking wrong, it's hard to do, and it takes time. You probably recognize in your teams that you thought right even after trying to think wrong. So like Cheeto started us out with, let go of your original ideas and just recognize like the amazingness of your team. Focus on those relationships and building the ideas out together. And that's what the accelerator can help with. So I hope that this was a really good start for you, and that we see you get even like wilder and crazier with your ideas and form like really good tight-knit relationships with your team, and that trust takes you to the next level. Back to you.
Awesome. All right. Well, that was perfect. Thank you, Ari. I think that was a great way to close out. And I'm really glad again to have you guys. Thank you again. And we'll follow up with you soon for next steps. Take care. Bye.
So we thank all of you, speakers, facilitators, everyone that stepped up in order to make this a reality. We have been having a ton of fun creating and imagining what the new future, what the new normal is going to be, and how we can help each other as a community and go beyond the I to the we. So we really want to make sure that we're creating those connections with people rapidly. So like, as you saw, there were many ideas that we're willing and looking for ways to connect with each other. So let's start by stepping forward into action. So thank you so much for coming and for participating. Okay, so thank you so much. See ya.